Hello, my name is Donna Lovell, and I'm here with Maya today, and we're sitting in Maya's living room, and we're very relaxed, and we're going to talk about ADHD today, Maya, and what is ADHD, and where ADHD originates from.
Okay. Ask your question. ADHD is, according to Dr. Sam Goldstein, who is a world-renowned expert on ADHD, it is a biopsychosocial disorder. What that means is it's biologically based, which means it's right in your genes, usually. It's part of your brain. It expresses itself in behavior, which is the psychology part of it, and it also affects your social skills. Not all people with ADHD have problems with social skills, but a lot of them do. The brain part is they lack dopamine, among others, and this is why some people are very hyper. It's because they're trying to create dopamine for their brain. The exercise, cardiovascular type exercise, which is fast movement, creates dopamine in anyone. It's a serotonin is the feel good. But anyway, it's the one that calms you down. When children are hyperactive in a classroom, on the playground, whatever, they are actually working on restarting their brains. If they get a lot of this or enough of it, they may have a good day in class that day.
And Maya, is it hard to get a diagnosis for ADHD?
Yes. A lot of people go straight to a psychologist, and they shouldn't. We will be doing a whole program on what to do and what not to do before you have somebody going to a psychologist. It's very expensive to go to a psychologist, and there's things that can be done. There are several other disorders, there's about 14 of them, that it can be that is not ADHD, and misdiagnosis can happen quite easily.
I understand, yes. And so, could you tell us if ADHD is hereditary or where?
80%, sorry, I didn't mean to interrupt you. 80% is genetic. So in other words, it runs in families. And then the other 20% is what they call acquired. And acquired could be fetal alcohol syndrome. It could be premature birth. If a child is very sick with a high fever, they can develop ADHD type behaviors.
And Maya, can you tell us a little bit, do you know if there is a cure for ADHD?
There is no cure for ADHD, but there is help. Now, the most common thing is medication, which is in North America, not in the world. Most of the world use other methods, and the problem with the medications is some of them are very dangerous. They can be addictive and that kind of thing. We offer some programs that help, and we offer programs for children under 6. We offer programs for school-age children, and then there's a gap, unfortunately, between 12 and 15, but we have offered some things for people over 15. We also offer support groups for the families and for adults and their partners and friends and family. We have 2 adult groups. You can now access our groups over Skype. So we are hoping to be able to service all of Nova Scotia. We also will go to or help groups start and help them run them in other parts of Nova Scotia if somebody wants a group to be started. Certain restrictions that we have to we make sure that the participants are protected. We have to pay for insurance for different things. We do provide some funding towards snacks, and we do the advertising for them. That is the biggest time that we have when it comes to support groups. It takes hours to do this.
So you were saying, Maya, that there is help out there for people with ADHD, and there is diagnosis. At what age would a diagnosis be for ADHD?
Well, a child needs to be at least 7, and
At Maya, what age would it be for a diagnosis for someone with ADHD?
a child should be able to have some abstract thinking, as well as so that is around 7. Children that are diagnosed below that, they're guessing, in my opinion. You know, going to have a lot of psychologists yelling at me because of that. But in Europe, they don't diagnose until they're 7. They help them, and they should help them.
I see.
They help them with behavior. They help their families, because ADHD is a family issue. It is not just a child or an adult. It affects the whole family.
Interesting.
So the whole family should be helped.
I see.
The family should be the ones that are in charge of it, because they're the ones who's going to have to. The best thing to do with children, for example, that have ADHD, is if you want to have some behavior change, for example, at school, because schools tend to be an area that's difficult, they should practice a new behavior at home where it's safe, where not in the classroom where the whole class is watching, because they will fail from time to time, and in the beginning especially, and they need encouragement. It's not a good idea to have a teacher trying to do behavior modification.
I see.
Unless the child already has that specific behavior down path, so that they can move it into the school, because they already have practiced it at home.
I see. And Maya, is there counseling out there for families with children or anyone with ADHD?
Yes, there are psychologists that help them out, and they should be helped. And when they're below 7, I don't think they should be labeled with ADHD, because that sticks with them for the rest of their lives. And quite often, well, maybe not. It can be. I mean, there's 14 things that look like ADHD, so it's very important that you get it diagnosed correctly from the beginning.
That's understandable.
You go ahead.
I'd like to thank Maya for being here today and talking about ADHD.
If you would like to send me questions about ADHD, write to ex.info@excalibur.adhd.org. Please put chat about ADHD in the subject line. I will answer questions about ADHD, but not about medications. That is a question that should be answered by the person who prescribes your medication, or your family doctor, or a pharmacist. It's outside of the scope of this particular program.
Hello, and Maya, what is ADHD?
ADHD, according to Dr. Sam Goldstein, who is a world-renowned expert on ADHD, it is a biopsychosocial disorder. It is biologically based, which means that it is part of the construction of the brain. People with ADHD have a slightly different wiring. It also affects their psychology, in other words, their behavior. And it affects their social skills. Everybody does not have symptoms of all of it. I know some people with ADHD that are really good at social skills, and I also know some people that are very bad at it. The main thing to remember about ADHD is that people that have it can live normal lives. They need some support and they need some encouragement, but it's not something that will destroy their lives, providing they get the support and encouragement that they need.
I see. It's quite interesting. ADHD, has it been around for a little while, or?
Well, I suspect it's been around forever. Was first described in the 18th century, and it has gone through several reincarnations since then. It was first in the DSM, which is the Diagnostic and Statistical Manual that psychologists use, mentioned in 1968, which was the DSM-2, and it has then been in every. It changed its name a little bit, but it has been around. The last one, they actually finally started addressing the fact that it goes on into adulthood. And the reason they used to think that children outgrew it was because the hyperactivity tends to wane. And but the inattention and the impulsivity still remains.
I see. And the ADHD, do you know if it is hereditary?
80% or so is inherited. It's hereditary. And so the child is born with it. A person is born with it. Then there are also acquired fetal alcohol syndrome, premature birth, among others. And also if a child is very sick with very high temperatures and that, they can develop ADHD that way, and that's called acquired ADHD.
I see. Like perhaps diet, is diet involved, or?
Diet, none of that. The causes that I mentioned are the only known causes. There are, diet can help. Very important that people with ADHD exercise, cardiovascular exercise. What they're lacking in their brain is dopamine, among others. They do lack some others as well, as serotonin, and by exercising they create dopamine.
I see.
And that can calm them down.
I see.
How it actually affects inattention is unknown to me. It's probably not unknown, but I really don't know how it affects inattention. But I would assume it does the same thing.
I see.
Biggest problems people phase that have ADHD is in their social skills. People with ADHD tend to interrupt others. They also tend to switch from topic to topic. Something new comes into their mind and off they go. So those are things that they can, through some programs, help. Their programs will help. There's no cure for ADHD, but there is help. And they can learn to control that a little more. And yeah, I'm going blank. I've had 2 really rough nights.